I tend to be involved in a lot of different sports. So as I've aged, that's taken on more running and cycling and playing golf, but when I was younger, I was doing quite a bit more as well. I also am very involved in various building projects. So I've done automotive restoration, built motorcycles, I do a lot of carpentry. When I went into medical school, I don't know that I ever thought I would be an OBGYN, but that gradually came to me through the process. And in the same sense, my choice to go into urogynecology has followed the same suit. When I went into residency and was doing my training for obstetrics and gynecology, I didn't really know I was going to be a urogynecologist. It was something that as time evolved and I became more exposed, that it was a natural progression in a way in which I was very much rewarded and found a good use for my skill set. In obtaining a board certification for female pelvic medicine reconstructive surgery basically assures you that you have physicians with the skill set and requirements that enable them to take care of women that have any number of issues involving pelvic reconstruction, incontinence, various pelvic pain issues, or just someone that sometimes has more complex surgical needs. A lot of people are hesitant to approach these issues. They assume that some of these issues are just age-related and there's not many things that they can do to correct that, which is not the truth. There's a lot of things that we can do that can restore their lives back to the point where they want them to be, where they are engaging in life in the way that they want to. I really like interacting with people and getting involved in their lives. And I think there's a lot of things that we can do that make very meaningful changes and help them restore function, restore abilities, get them back to places they want to be and doing things they want to do. And it's kind of fun to be involved in that process. Where is the patient coming from? I think a lot of times as physicians, we can kind of label patients as diagnosis. I think it's important to frame that diagnosis and how it affects them. I think your compliance is going to be so much better if you can frame what they're dealing with and what you actually label as their diagnosis in the context of how is this impacting their lives. And if you can approach the patient in that way as far as what is this disease process doing to you, not just this is the disease, I think you're going to have a lot better outcomes.